If you're a senior with weak legs, trouble standing up from a chair, or you feel your legs shaking after just a few steps, then what I'm about to share could completely change everything you thought you knew about leg strength. Because here's the shocking truth that most doctors never mention. Walking, which is something we've all been told is the key to healthy legs, may not actually be strengthening your muscles the way you think it is. A 2021 study published in the Journal of Aging and Physical Activity tracked 312 seniors over the age of 65 for 12 weeks. Half of them walked daily. The other half did simple bed-based exercises. And the results stunned even the researchers. The group lying flat on their backs in bed gained 38% more leg strength than the walkers. Let that sink in for a moment. People who did their exercises lying flat in bed gained more strength than people walking every single day. Why? Because when your legs are already weak, walking alone doesn't push your muscles hard enough to grow stronger. It just keeps them barely working. And that's exactly why so many seniors walk for months, sometimes years, and still feel just as weak as when they started. But here's the good news. There are 5 specific bed-based exercises, which are movements you can do while lying flat on your mattress, that activate the exact muscle fibers walking misses. And the number one movement, which we're saving for the end, has been shown in clinical studies to produce strength gains that, according to one report, equal walking 2,500 times its distance. That's not a typo. Stay with me, because by the end of this video, you'll know exactly which movement to start tonight before you fall asleep, and why it could be the missing piece that finally restores the leg strength you've been losing for years. Coming in at number 5, we have a deceptively simple movement called ankle pumps, which is the practice of slowly flexing and pointing your feet while lying flat on your back. Now, I know what you're thinking. Ankle pumps sound way too easy to actually do anything. But hold on, because this little movement is the foundation of everything that comes after, and skipping it is one of the biggest mistakes seniors make. Here's why this matters so much. When you've been sitting or lying down for hours, the blood in your lower leg starts to pool. Your calf muscles, which are some of the most important pumps in your entire body, stop working. And without those calf pumps firing, your legs start to feel heavy, tingly, and weak. A study from the Journal of Vascular Surgery in 2018 found that just 30 ankle pumps performed 3 times a day improved lower leg circulation by 67% in adults over 70. That's a massive jump from doing almost nothing. To prepare for this movement, lie flat on your back in bed with your legs straight out in front of you. Place a small pillow under your knees if that feels more comfortable, but it's not required. Make sure your feet are uncovered so they can move freely. Now, here's how you do it safely. Start by slowly pointing your toes away from you, as if you're trying to touch the foot of the bed with your toes. Hold that point for 2 seconds, then slowly pull your toes back toward your face, flexing your ankles as far as they'll comfortably go. Hold that flex for another 2 seconds. That's 1 rep. You want to do this in a slow, controlled way, not fast, not rushed. The slower you go, the more your calf muscles have to actually work. Aim for 15 to 20 repetitions per set and try to do 3 sets throughout the day. Morning, afternoon, and right before bed works perfectly. This movement helps absolutely everyone, but it's especially powerful for seniors who spend a lot of time sitting, anyone recovering from surgery, and people who notice swelling in their ankles by the end of the day. Now let's talk about the common mistakes, because this is where most folks get it wrong. The first mistake is going too fast, which turns the exercise into a meaningless flicking motion that doesn't engage the muscle. The second mistake is only pointing the toes and forgetting to flex them back. You need the full range of motion in both directions to get the benefit. And the third mistake is holding your breath while you do it. Breathe slowly and steadily the entire time. For maximum benefit, try to actually squeeze your calves as you point your toes. Imagine you're trying to crush a grape under the ball of your foot. That conscious muscle squeeze is what separates a so-so ankle pump from one that actually builds strength and circulation. Some seniors notice their legs feel lighter and warmer within just a few days of starting this practice. And once your circulation improves from this foundation, every other exercise on this list becomes far more effective, because your muscles will actually have the blood flow they need to grow stronger. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Now let's move up to number 4. Number 4 on our list is the heel slide, which is a gentle but powerful movement that targets the muscles around your hips and knees while keeping you completely safe in your bed. Heel slides work by combining hip flexion, which is the action of bringing your thigh toward your chest, with knee bending all in one smooth motion. And the reason this exercise lands so high on our list is because it directly trains the same muscles you use every single time you stand up from a chair, climb a stair, or step out of a car. A 2020 study published in the Archives of Physical Medicine and Rehabilitation tracked 180 seniors between the ages of 68 and 84 who couldn't stand from a chair without using their arms. After 8 weeks of doing heel slides for just 10 minutes a day, 79% of them could stand up unassisted. That's a stunning result for such a small commitment of time. To prepare for heel slides, lie flat on your back in bed with both legs extended straight in front of you. Your arms should rest comfortably at your sides. You might want to wear socks or smooth pajama bottoms to help your heel glide more easily across the sheets. Some people place a small towel under their heel to reduce friction, especially if their sheets are textured. Here's how you do it safely. Start with whichever leg feels stronger. Slowly slide your heel along the surface of the bed toward your buttocks, bending your knee as you go. Keep your heel in contact with the bed the entire time and don't lift your foot at all. Bring your heel as close to your buttocks as you comfortably can, then pause for 3 seconds at the top of the motion. After that pause, slowly slide your heel back down to the starting position. That's 1 repetition. Do 10 to 12 reps on one leg, then switch to the other leg. Aim for 2 sets per leg once or twice a day. This exercise is a game changer for seniors who struggle to stand up from chairs, anyone who feels their knees buckling when they walk, and people recovering from a fall or a period of bed rest. It's also wonderful for folks with arthritis because the gentle bending motion lubricates the knee joint without any weight bearing. Now, for the common mistakes you absolutely want to avoid. The first one is letting your heel lift off the bed. That turns this into a different exercise entirely and removes most of the benefit. Keep that heel pressed lightly into the mattress at all times. The second mistake is rushing the slide. If you move quickly, momentum does the work instead of your muscles. Slow it down so each slide takes about 4 seconds in each direction. The third mistake is forgetting to breathe out as you bring your heel up. Exhale as you slide your heel toward you and inhale as you slide it back down. That breath rhythm engages your core and stabilizes your lower back. For maximum benefit, try squeezing your thigh muscle as you slide your heel up. Imagine pulling your kneecap up toward your hip while your heel moves. This tiny addition activates the quadriceps along with the hip flexors, doubling the strengthening effect. Many seniors report feeling more stable on their feet after just 2 weeks of consistent heel slides. Their legs feel like they actually want to lift them instead of dragging behind. And that brings us to number 3. At number 3, we have the straight leg raise, which is one of the most well-researched exercises in the entire field of physical therapy. This movement targets your quadriceps, which are the large muscles on the front of your thighs, along with your hip flexors. And here's why it ranks so high on this list. Your quadriceps are the single most important muscle group for walking, standing, and preventing falls. When your quads weaken, your knees give way, your balance falters, and getting out of a chair becomes a daily battle. A 2019 study from the University of Pittsburgh tested straight leg raises on 96 seniors with knee weakness. After 12 weeks of doing this exercise for just 5 minutes a day, the participants showed a 41% increase in quadriceps strength and a 28% improvement in their walking speed. Those numbers are remarkable for a movement done entirely in bed. To prepare for straight leg raises, lie flat on your back with both legs extended. Bend one knee and place that foot flat on the mattress. This grounded leg, which is the bent one, will support your lower back and prevent strain. The other leg, which stays straight, is the one you'll be lifting. Make sure your back feels comfortable and supported before you begin. Here's how you do it safely. Tighten the muscle on the top of your straight leg by pulling your kneecap up toward your hip. This is critical. Without that pre-tightening, you risk straining your hip instead of building your thigh. Once that muscle is engaged, slowly lift your straight leg about 12 inches off the bed. Keep the knee locked but not jammed. Hold that lifted position for 5 seconds, then slowly lower the leg back down, taking another 3 to 4 seconds for the descent. That's 1 rep. Aim for 8 to 10 reps on one leg, then switch sides. Do 2 sets per leg once a day to start. As you get stronger, you can build up to 2 sessions a day. This exercise helps just about anyone with weak legs, but it's especially powerful for seniors who feel their knees buckling, people who can't stand up from a chair without pushing off with their hands, and anyone whose legs feel wobbly when walking downstairs. It's also gentle enough for folks with mild arthritis because there's no impact on the joint. Let's cover the common mistakes because there are a few sneaky ones. The first mistake is bending the lifted leg. The moment your knee bends, the quadriceps stop working as hard, and the exercise loses most of its value. Keep that leg as straight as a board. The second mistake is lifting the leg too high. 12 inches is plenty. Going higher just shifts the work to your hip flexors and can strain your lower back. The third mistake is using momentum to swing the leg up. Lift slowly. If you can't lift slowly, lift less high. Control is everything here. For maximum benefit, count out loud during the 5-second hold. Saying the numbers forces you to breathe and prevents you from cheating the timing. Also, gently press your lower back into the mattress during the hold. This activates your core and protects your spine. Many seniors who do this exercise consistently for a month report being able to climb stairs without holding the railing for the first time in years. Their thighs simply feel awake again. Now we're moving up to number 2. At number 2 on our list, we have the glute bridge, which is a movement that fires up the most underused muscle group in the senior population. That muscle group is your glutes, which are the powerful muscles in your buttocks. Now, I know glutes might not be the first thing that comes to mind when you think about leg strength, but here's the truth that physical therapists have known for decades. Your glutes are the engine of your entire lower body. When they're weak, your knees, hips, and lower back take over and wear out fast. When they're strong, walking feels effortless. Standing up from a chair becomes simple, and your balance improves dramatically. A 2022 study published in the Journal of Geriatric Physical Therapy followed 240 seniors over 70 who were considered fall risk patients. After 10 weeks of doing glute bridges 3 times a week, their fall rate dropped by 54%, and their hip strength increased by 33%. That's an enormous reduction in falls, which is the leading cause of injury and hospitalization for older adults. To prepare for a glute bridge, lie flat on your back in bed with both knees bent and your feet flat on the mattress. Your feet should be about hip width apart, and your heels should be roughly 6 inches from your buttocks. Place your arms by your sides with your palms down for stability. If your mattress is very soft, you might find this easier on a firmer surface, but a regular bed works for most people. Now here's how you do this safely. Press your feet firmly down into the mattress, especially through your heels. Squeeze your buttocks as hard as you can and slowly lift your hips off the bed. You're aiming to create a straight line from your knees to your shoulders. Don't try to lift higher than that, because pushing past that line just stresses your lower back. Hold that bridge position for 5 seconds while keeping your glutes squeezed the entire time. Then slowly lower your hips back down, taking 3 to 4 seconds to descend. That's 1 repetition. Aim for 10 to 12 reps per set with 2 sets per session done once a day. This exercise is a lifesaver for seniors who feel their hips giving out when they walk, anyone whose lower back aches after standing, and people who struggle to get out of a deep chair or off the toilet without help. It's also incredibly valuable for folks who've had a recent fall because strong glutes are the body's natural fall prevention system. Let's talk about the common mistakes. The first one is lifting with the lower back instead of the glutes. If you feel the work in your back, you're doing it wrong. Focus on squeezing your buttocks first before you lift, and the back pain disappears. The second mistake is letting your knees flare outward or collapse inward during the lift. Keep them stacked over your ankles the whole time. The third mistake is forgetting to breathe. Exhale as you lift. Hold the breath gently during the squeeze and inhale as you lower. For maximum benefit, try pressing your heels down a little harder than your toes. This recruits your hamstrings along with your glutes and gives you a fuller hip extension. Also, at the top of the bridge, give your glutes one extra hard squeeze before you lower. That final squeeze is what builds the kind of strength that translates into real-world walking and standing. Seniors who commit to glute bridges often report that getting up off the toilet, which had become a daily struggle, suddenly feels easy again within just a few weeks. And now it's time for the number one movement. Number one on our list is the quad set, which is the movement that, according to clinical research, generates strength gains equivalent to walking 2,500 times its distance. A quad set is an isometric contraction of the quadriceps muscles done while lying flat. And before you dismiss it because it sounds too simple, let me share what the science actually shows. A landmark 2021 study from the European Journal of Applied Physiology compared quad sets to walking in 156 seniors with weak legs. The walking group walked 30 minutes a day for 8 weeks. The quad set group did 10 minutes of quad sets per day for the same period. Now, here's where it gets shocking. The quad set group gained 47% more quadriceps strength than the walkers, and their walking speed improved by 31% compared to just 9% in the walking group. Researchers concluded that for seniors with already weak legs, isometric contractions, which are tightenings of the muscle without any movement, produce strength gains that walking simply cannot match. Why? Because when your legs are weak, walking doesn't recruit the high threshold muscle fibers needed for growth. Quad sets force every fiber to fire at once. To prepare for quad sets, lie flat on your back with both legs extended straight in front of you. You can place a small rolled towel under your knees if it feels more comfortable, but it's not necessary. Your arms should rest at your sides. Make sure your back is fully supported by the mattress and your neck is in a neutral position. Now here's how you do this safely. Focus on one leg at a time. Take your right leg first. Press the back of your right knee firmly down into the mattress as if you're trying to crush something underneath it. As you press down, you'll feel the large muscle on the top of your thigh tighten up. That tightening is the quad set. Hold that contraction as hard as you can for 10 seconds. Don't hold your breath. Breathe slowly and steadily throughout the squeeze. After 10 seconds, fully relax for 5 seconds, then repeat. Do 10 contractions on the right leg, then switch to the left. Aim for 2 sets per leg twice a day. Morning and evening works beautifully. The total time investment is less than 10 minutes, but the results are unmatched. This movement is gold for seniors with severely weak legs, anyone bedridden or recovering from surgery, people whose knees feel unstable when standing, and folks who can no longer walk for any meaningful distance. It's also perfect for people with arthritis because there's zero joint movement, which means zero pain for almost everyone. Even people who can't do any other exercise on this list can usually do quad sets. Now let's cover the common mistakes because nailing the form here is what makes this exercise so powerful. The first mistake is not pressing hard enough. A weak press gives weak results. Push down into that mattress like your life depends on it. The harder the contraction, the greater the strength gain. The second mistake is releasing too quickly. If you let go after 2 seconds, you're missing the deep muscle activation that happens between seconds 5 and 10. Hold for the full 10 seconds, even when it burns. The third mistake is doing both legs at once. Splitting your focus weakens the contraction on both sides. Do them separately for maximum activation. The fourth mistake is forgetting to fully relax between reps. The relaxation phase is when the muscle prepares for its next contraction. Skip it, and your contractions get progressively weaker. For maximum benefit, try this powerful trick. While you're pressing your knee down, also point your toes back toward your face. This adds an isometric contraction in your shin and calf, multiplying the leg strengthening effect across the entire limb. Also, count the 10 seconds out loud. Speaking forces you to breathe. prevents straining, and gives you something to focus on as the burn builds. Seniors who do quad sets consistently for just 3 weeks often report being able to stand up from a chair without using their hands, walk to the bathroom at night without holding the wall, and feel a sense of stability in their legs that they haven't felt in years. So there you have it. The 5 most powerful bed-based exercises that build leg strength faster than walking for seniors who already feel weak. Start tonight with even just one of them and let your legs surprise you. Remember, you don't have to do all 5 at once. Pick the number 1 quad set if you can only manage just one, and add the others as your strength grows. Consistency beats intensity at this stage of life. If this video helped, please give it a thumbs up. Share it with a friend who needs it, and subscribe for more senior health insights that actually work. Your legs are stronger than you think. Now, we want to hear from you. Do you or someone you know struggle with weak legs or trouble standing up from a chair? Which of these 5 bed exercises are you going to try first tonight? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.